Good evening, everyone. We are so glad that you are joining us this evening. I am Dr. Rashida Monroe. I'm a pediatrician and medical director at Wake Med, and I will be serving tonight as the moderator for this evening's town hall. The purpose of this town hall is to provide resources and information to improve the well-being of African Americans and Black residents of Wake County who may be struggling with stress, depression, and anxiety during this very difficult time during this COVID pandemic. We know that at baseline, Black Americans are 20% more likely to experience mental health issues. Non-Hispanic Black adults are 48%, and Hispanic or Latino adults, 46%, are more likely to report symptoms of anxiety or depression than non-Hispanic white adults. And historically, we know that these communities of color have faced challenges accessing mental health care. Research has also shown that during this pandemic and the resulting economic recession, we have been negatively impacted as far as mental health and creation of new barriers for people who are already suffering from mental health and substance abuse disorders. So our goal tonight is to give you the opportunity to discuss and ask questions to our panel of experts. First, I'll establish some ground rules for this evening's chat. Number one, this is a community event, so please be respectful of others and participants in your actions and your words. Remember that we're all learning, so please don't hesitate to be curious and send questions and comments through the chat. And finally, we want everyone to enjoy themselves and feel safe in this environment. So we will take appropriate measures to ensure the collective well-being of all of those participating. We will start with an introduction of Mrs. Lachelle Wardell, who is the Director of Community Outreach for COVID for Wake County. And Lachelle will discuss the polling questions that you will have an opportunity to answer. Lachelle, I'll turn it over to you.
Great. Thank you, Dr. Monroe, and it's a pleasure to be with you tonight, and a pleasure to have all of our experts here as we discuss mental health. So just very briefly, I will share my screen here. So I should be, here we go. There we go. So what you'll see in front of you is a link to tonight's town hall poll. We would like for you, as you participate in tonight's event, to please go online. You can just cut and paste this website into your browser, into whatever device you're using, and just take a few moments to answer the few questions that we have in here. We want to just get your information and get some information from you about your thoughts on COVID-19, whether or not you plan to get vaccinated, as well as whether or not you believe these forums are helpful. So again, just cut and paste this browser. Cut and paste this link into your browser. It is being posted into the chat section. So you can just cut it from there. And at the end of tonight's session, we will go back and look at the results. So thank you very much. I hope you all enjoyed tonight's session. We look forward to a wonderful evening. So thank you, Dr. Monroe. I'll turn it back over to you.
Thank you so much, Lachelle. I will move forward with introducing our amazing panelists. And I will introduce them one by one and give them an opportunity to introduce themselves. We will start with Dr. Rosalind Spells. Dr. Spells is a board-certified psychiatrist by the American Board of Psychiatry and Neurology and has fellowship training in child and adolescent psychiatry. Her medical degree is from the University of Texas Medical Branch at Galveston. She completed her general psychiatry residency and child and adolescent psychiatry fellowship training at the Medical College of Georgia. She has a broad range of experiences across multiple age ranges and treatment settings and adapts well to the challenges of underserved environments. Dr. Spells, I'd love for you to tell us about yourself and a little bit about your time in treating patients during the time of COVID.
Well, good evening, and it's nice to be able to be a part of this wonderful format. I think it's great that we've had the opportunity to allow people to, kind of get some feedback from professionals about such a scary time in our environment. With regard to the way that my practice has changed as a result of COVID, primarily, the biggest change for me has been where the patient is. Ironically, I have been doing telemedicine exclusively for the past 6 years. And so my office has been at home for several years, obviously. But in the way that I was practicing previously, patients would come to an office and then be checked in, their vital signs done, and all of those things by support staff. The changes that have come into play because of COVID and not wanting to have large groups of people in buildings has required for us to be a little bit more creative, having individuals take their own weight and show me on the camera. Individuals who have access to a blood pressure cuff. That takes away the consistency that we're accustomed to, but at least it gives us somewhere to start when we have the need for that type of information when we're prescribing medications. So that's been the biggest change for me.
Excellent. Thank you. Well, we look forward to talking with you more and giving the audience an opportunity to ask you questions about, grief, anxiety, and depression, especially as it pertains to, children and adults during this time. Our next panelist is Dr. Leslie Bronner. Dr. Bronner is a psychiatrist at Duke University Health System. She started her career in public health, working on cardiovascular disease, but soon turned her attention to behavioral health and completed a residency in psychiatry. Dr. Bronner has diverse experiences in public health, research, clinical care, administration, and patient advocacy. One of her most meaningful experiences was when she worked in a residential substance abuse treatment center for pregnant women and women with children. She has since dedicated her career to understanding social factors, their impact on health status, and trying to make an impact through her clinical work. Dr. Bronner, welcome, and please tell us a little bit more about yourself.
Thank you, Dr. Monroe. Just wanted to say first how glad I am to be here answering questions about mental illness. I've been a psychiatrist for many years, and I've worked in a lot of different settings, outpatient clinics, community mental health, the state hospital, the VA medical center, and currently I'm an inpatient psychiatrist at Duke Health System. Because of these experiences, I know firsthand how socioeconomic factors such as unemployment, homelessness, poverty, and food insecurity impact mental health risk and mental health outcomes. However, I think the pandemic has opened a lot of people's eyes to the effects of socioeconomic factors on mental health. In the work that I do on the inpatient unit, I've seen a lot more people coming into the hospital. Some of these people have had pre-existing underlying mental illness that was made worse by the pandemic, but others developed the mental illness for the first time due to the stress. However, one of the most devastating factors of the pandemic was that in order to stay safe, you had to stay away from people. And we know, and I think we've kind of taken this for granted, that it's our connections with other people that can bring the most emotional healing. So I've spent a lot of time over the past year talking to people about the importance of human connections and trying to help people problem solve about the ways to stay connected and while staying safe. So now as the country opens up and people start to return to their busy lives, I just don't want people to forget how important human connections are to our emotional health. And I encourage people to continue to prioritize meaningful social connections because it can make you stronger as an individual and it can make us stronger as a community. Thank you.
Thank you so much, Dr. Bronner. And again, we look forward to talking with you more. I will introduce our next panelist, Reverend Jeremy Gilmore. Reverend Gilmore is the Director for Spiritual Care at Wake Med Health and Hospitals. He is a native of East Chicago, Indiana. He has earned degrees from Indiana University and Duke University, and is currently a PhD student in Educational Leadership, Policy, and Human Development at North Carolina State University. Jeremy completed his clinical pastoral education supervisory training at the Durham VA Medical Center, where he also was a palliative care hospice chaplain. Before coming to Wake Med, he was the coordinator of clinical pastoral education at UNC Rex. In these and in his current roles, he has helped patients, hospital staff, and students process their grief and better care for themselves. Reverend Gilmore, welcome. Please tell us a little bit more about yourself and what it's been like caring for people during this time of COVID.
Yes. Thank you, Dr. Monroe, and like the other panelists, I want to thank you for this opportunity. Thank Wake County government organizers for this opportunity as well to be with you all. Looking forward to the time tonight. As you said, I'm the Director of Spiritual Care at Wake Med. In that role, I lead the Department of Spiritual Caregivers, or what most folks refer to as chaplains. And we support families and patients, staff in times of trauma and suffering, and often on what are the worst days of their life. During COVID, we have seen things we've never seen before, where patients and families, I agree with what Dr. Bronner is saying, have been isolated from one another and not able to experience the suffering and support one another through suffering as we know is needed. For me, I wanted to share that for me, this is complicated because actually when I started in my position, shortly after the pandemic started, I contracted COVID myself. And that kind of took this from being, a kind of distant reality to a very personal one quickly. And last May, I had to go through the 10 days of isolation and the various checks and visits and the stigma, again, related to that too at the time where we didn't know much. And so it was a difficult challenge for me, and one where I also witnessed my own mental health challenges and realized this is hard to be away from people and to not know what's next and to not be able to talk about it because of the social stigma. And so the work that I do now is, obviously is motivated by more than just myself in the clinic and in the hospital, but we're supporting people through this very tough time. Thank you.
Thank you so much. And thank you for sharing about your personal experience, contracting and fighting through COVID. I can imagine we can learn so much about that from you and the patients that you have been able to interact with. You've been able to, be impactful with them because you had that personal experience. So thank you for sharing that. Our next panelist, our final panelist, is Cheryl Cromedy. Cheryl Cromedy is the Director of Personal and Economic Empowerment Program, PEEPS, at Interact, a nonprofit domestic and sexual violence agency that saves lives, rebuilds lives, and secures safer futures for victims and survivors and their families. She has over 25 years of experience in government, nonprofit, and private sector. In addition, she has experience as a marriage and family therapist and relationship strategist. As a director of PEEPS, Cheryl manages the case managers and outreach counselors, daily operations, and program developments of PEEPS. PEEPS provides case management, domestic violence and sexual assault support groups, client resource development, and economic educational empowerment services. Her background consists of a Bachelor of Science in Business Administration, Master of Science in Business Administration, and a Master's of Science in Marriage and Family Therapy. Thank you so much for being with us today, Ms. Cheryl Cromedy. Please tell us a little bit more about yourself and what have you seen has been the impact in the work that you do during the time of COVID?
Awesome. Good evening, everyone. Again, my name is Cheryl Cromedy. It is a pleasure and an honor to be here. So I'm so grateful for being here tonight. One of the things that we have seen with domestic violence is there has been an increase in escalation. So whereas we may have seen the emotional trauma, we have seen the mental trauma and definitely the verbal, because clients are more confined in the home with their abuser and can't get out because of COVID, especially in the beginning, that there was that escalation that was happening to the physical, and it was getting there kind of rapidly. We also know that whenever there are problems and stresses in finance, such as unemployment as well, and just having to be in close proximity with that abuser with nowhere to go, that it escalates and it escalates quickly. So typically what we would see with the crisis lines, because we have been working from home March of last year, and all of our services have gone virtual, except for our emergency shelter and our solace center. And a solace center is where a survivor or a rape victim can actually have a kit done without having to go to the emergency. What we have seen is that most of them are wanting to leave, but concerned about leaving because they don't know what the shelter environment is like. They're afraid of being in a contract with other families and other people. And so they're more reluctant to leave. What was happening in the beginning, a lot of the shelters, when they were full, were not accepting any new clients. And that was causing an issue because what we would do was transfer them to a shelter that was out of county. But recently we have gone to a non-conjugate where each family has their own individual room. They're not sharing any type of common spaces or kitchens or anything of that nature. And so it makes it a lot safer for them with COVID. We have seen an increase in the number of calls we're receiving. We used to get anywhere between 15 and 20, but now it's more like 30 to 35 calls per day. So they are beginning to reach out more as time is going on.
Thank you so much, Cheryl. And we look forward to hearing more about your services and how you have been able to help people during this pandemic. So we will go ahead and get started with the Q&A. I will be fielding questions from our audience, and I will have our panelists answer them. This first question, Dr. Spells, I'm going to give this first question to you. Okay. So this question comes from Paul J. Alston. Thank you for your participation. He asks, are there tips you can share with parents and talking to their children about mental health changes they may be experiencing due to the pandemic? And I really appreciate that question, especially as a pediatrician, because we are seeing so many children present with, anxieties and fears and sadness. So, Dr. Spells, what can we as parents do to talk to our children about these mental health challenges?
Mm-hmm. I think that's a great question. A couple of things that I think are really important to keep in mind whenever we're talking about talking to children is that a child's response to something traumatic is very heavily contingent upon their caregiver's response to that same trauma. And so it's important for you to try to keep your cool in their presence so that they are not just feeding off of the energy that you're putting out. having a really open and honest approach to the information that you're sharing information on their level. So trying not to use a lot of big words that leave them more confused about what's going on. But also gauging what information is going to be helpful as far as increasing their knowledge while not worsening their fears. So when we talk about COVID, there's still, we're a year into this, and there's still a lot of things that we truly don't know. We have an idea, we have some thoughts, and we have a year's worth of data that says this is what happened so far. But there's a lot of things that we really don't have can I still catch it if, or, there are a lot of things that we just don't know. And so being honest about that, I think, is really important, but also not adding extra detail where it's really not needed. Those are really, really big things that are important when you're talking to kids in general about these types of issues. When we talk about their mental health and their specific concerns, specific worries about their own, mortality or concern about having an illness affect their family, I think it's really important to acknowledge that their concern is a valid concern, because we're all susceptible. No one can truly live in a bubble 100%. Someone's coming in or out of the house. Something's coming in or out of the house. And so, again, honesty is really a big issue, because it's unlikely that your child's not going to get information from other areas, especially if they're old enough to read or old enough to have conversations with people that don't live in your home. Making it a safe space for them to share what they're worried about. So when they say, "Mommy, I'm scared that you're going to die," don't just dismiss that. Allow them to say why they're feeling that way. What is it that worries them? Is it because you go to work every day, you leave, and they hear about people going to jobs and then going to the hospital and never coming home? Or is it something else? They saw you, bring something in and they didn't notice you didn't wash your hands. I mean, that's something that you actually can affect change upon and be more cognizant about, but that might help reassure them. And so sometimes it's really the small things that kids notice when they are hearing information. It's not even necessarily they're hearing wrong information, but their interpretation of what things mean can sometimes be different than the reality. And they're likely to notice a lot of small details that as adults, we sometimes just take things for granted, and kids are watching, they're always watching. So making sure that the line of communication is there is really the biggest thing. Making it a safe space for them to express what they're concerned about. And then to the extent that you're able, reassuring them that you're going to do the best that you can do to try to keep them safe and everyone they care about, to the extent that you can.
Thank you. Those are some really good kind of practical points. I've noticed as a pediatrician that a lot of children are really anxious about this re-entry, right? As the world is kind of opening back up a bit. And, I think it's just going to be so important for us to continue to, to support them and to, validate those, anxieties and fears and go slow. Like we say in medicine with medications for the elderly, go low and slow, right? That we'll have to reintroduce children, back into, school and social circles and things like that as it's safe. So those are some really good points. Thank you so much for that. This question comes in again from Paul Alston. With the recent J&J hold, do you see more people of color, Black and Hispanic, who already had anxieties about being vaccinated, not wanting to be vaccinated? And I might take a crack at that question, because I've been vaccinating Black and Brown people throughout our communities for the past 3 months as a part of our strike team events, partnering with Wake County, Wake Med, Lachelle, Wardell. And so far, I have gotten a couple of emails and calls about J&J. I even got a question from someone saying, are they withholding J&J from everyone else and still giving it to Black people? Is this another Tuskegee? I got that as an email. So the truth is, the pause on the J&J vaccine, because there were 6 people out of 6 million people, almost 7 million, who had received the vaccine at this point, had these rare blood clots. So it's still exceedingly rare and low numbers of people, but there was this signal that was seen, and there's a pause on delivering that vaccine to all communities, not white or just Black, and no one's receiving J&J right now, as this is being further investigated. And to me, that's a good thing, because that means the reporting and the signal monitoring is working. For us to pick up 6 out of almost 7 million people who have experienced this rare side effect, I appreciate the transparency and the thoroughness of this evaluation and investigation. Now, I've not heard people then say yet, though I can imagine there are people who are saying, never mind, we're anxious about vaccines in general, and this just goes to show why we should be. I've seen people who had planned to get J&J, gladly switch to decide that one of the mRNA vaccines, Pfizer and Moderna, who, we've given hundreds of millions of doses, and they have been shown to be safe and effective. What about you all? Are any of you guys hearing from anyone yet about anxieties and fears about vaccines in general, more so now that the J&J vaccine is on pause? Dr. Bronner?
Actually, I have not heard anything recently. I just hear people saying that they want to get the vaccine, but they haven't really talked specifically about the J&J. So I'm still waiting to see how people respond.
Mm-hmm. Yeah, it'll be interesting to see. I don't know, but I hope that we will have access to that vaccine again if it's proven to be, safe and effective, like we expect. Dr. Bronner, while I have you here, I'll ask you this next question. Is it possible for some of the side effects that people experience from the vaccine could be caused by anxieties and fears? Could some of those side effects be caused by anxiety? We know and expect that some of the side effects from the vaccine, as your immune system is revving up and making the appropriate antibodies, that you may have, fatigue or fevers or headache or pain at the injection site, even kind of flu-like symptoms. But what do you think? Can the actual anxiety that people are experiencing cause some somatic effects?
Well, yeah, I think that's a very good question. And I think what people do experience related to the vaccine is related to the stress probably of trying to get the vaccine itself. And so a lot of times people can have some sort of, as you say, somatic symptoms, physical symptoms based on the anxiety, which they may attribute to the vaccine, but it may be really associated with the anxiety that they're experiencing. And sometimes it's hard to tell the difference. And so when people are getting the vaccine, we really just tell them, you have to try to manage the stress so that we can see whether there's other things going on outside of stress response, possibly to just getting a vaccine.
Thank you. All right, these questions are coming in. I like this question from Laura Marie Piazza. And Dr. Spells, I'm going to send this one back to you. So Laura Marie says, I've decided personally to keep my 3rd grade child as a virtual student until there's a vaccine available for his age bracket. With Wake County schools having hardly any restrictions besides masks, for in-person students and the rise in Wake County among students, I feel it's best to keep him home. That being said, he'll be a virtual student for 2 straight years. The question is, what can I do at home to maintain his mental health and not stunt his emotional growth? Along with that question, Dr. Spells, someone has asked, what are the safe forms of socialization that consider the social emotional well-being of children? So people are worried about it. What do we do to help maintain the mental health and social emotional health of our children during this time? Dr. Spells, you're muted.
Thank you. Sorry. I've gotten this question a lot, and I'm glad to know that it is something that's heavy on people's minds, because that means that they are thinking the right way about trying to make sure that their children's needs are met. What I have been recommending for individuals who are saying, you know, my kid's not physically on site in school, and therefore we want to try to make sure we're establishing and maintaining healthy relationships. There's several things that I've suggested for those types of concerns. One of them is having basically meetings like this. This is, you know, if you have a set of peers that you're familiar with the parents, and you guys can have Zoom meetings, things like that. Outdoor activities is another big thing. Small groups where you go to the park. You know, a lot of times kids will have fun running around with each other, even though they're not really doing much besides running around. And so it helps them burn off some energy, allows them to spend time with friends, have face-to-face contact, but still low risk for exposure to COVID and transmission. When we talk about just what is safe, I think in part what I mentioned, trying to minimize the risk of exposure. If you have ways to monitor their electronic communication, especially when you're talking about older kids who are a little bit more likely to get into mischief online, then I think that that's a reasonable way to stay in communication, you know, with peers, with relatives, with family members. Other things that that I often suggest are like interactive activities that allow free-flowing dialogue. You might have seen, I can't think of the name of it, but there are a couple of different card games that are kind of, you see them pop up on Facebook, and they are designed to help. They're almost like prompts. They're like conversation starters, but they're also things that help you have thoughtful dialogue, as opposed to just, have you ever, you know, ran out in the street before? You know, it's not those kinds of things. The things that require you to have kind of a thoughtful response and a quality dialogue, because that's part of what is missing for a lot of people, is that quality interaction that requires kind of joint attention, and both people to have some sort of emotional connection to the conversation, to the interaction. So those are the kinds of things that I've been recommending.
Thank you, Dr. Spells. And, you know, I'm a mother of 2 little boys, and we have been very cautious during this time. Of course, I'm a physician going to work every day, seeing, you know, and evaluating COVID patients. And one thing that has been great for them is the small group and outdoor. And in the beginning, you know, I would set up chairs outside, and they would be like, you know, 10, 12 feet away from their peers. I'd let 2 peers come over, and they would just chit chat, or I'd even let them, if they were, you know, outside in distance, they could, you know, eat pizza at the same time, right? but I am feeling more comfortable with, we've got so much evidence about the great ventilation outside. And so if you're masked, sometimes with sports we'll be masked with goggles, right? Because eye protection helps. And I've started letting them participate in some kind of small group sports outside, especially distance things like baseball. So they're playing baseball right now. So I love that idea. And you're right. Sometimes kids, it doesn't have to be anything structured or planned. They just need to get the wiggles out and see a pier and run around outside. So wear your mask, be distance, and get out. Thank goodness the weather is getting wonderful. Reverend Gilmore, I'm going to pose this next question to you. This participant asks, I had 2 family members die during this past year and was not able to attend any of the funerals. How are we supposed to find closure in these times?
Yeah, thank you for the question. This is, I feel like, one of, outside of the physical consequences of COVID, which are devastating. We know nearly 600,000 people dead. We know that. The toll on the emotional and social toll that this has taken on our community, I think we're going to see the impacts of these for generations. People not being able to grieve properly. One study showed that African Americans actually experience complicated grief more often than Caucasians. And this was pre-COVID, a pre-COVID study. And I think that's been compounded in the last year. So not just with the loss of life, which is itself devastating, but then the ability to not, or the inability, that is, to not have closure, have a service, have a ceremony. It compounds and complicates the grief. And so, yeah, I just want to name that first. In terms of ways to do that, I think this is a time where creativity and innovation are helpful. What are ways that you can memorialize the person? Are the places they love to go, things they love to do? What are moments that you share together? Are there commemorations you can make? One thing that I've felt for myself, even, we're sharing, and I think sharing is caring, right? The studies show that sharing is caring. And one thing for me, last year was a very complex year. I said in February, my father died of cancer last year as well. And this is, every year is not like 2020, but 2020 was a year for me. And his funeral was right before the pandemic struck at the end of February. And while it was very hard, I was so grateful, 2 months later, that we were able to honor him and to bury him, and to know that people after that couldn't experience that. That was very hard. So one of the things that we've tried to do in his life, which I offer as a recommendation, is to find something that he loved and commemorate that around his birthday, around the time of his death. He was a big White Sox fan. And so, when baseball season started back up again, that gave us an opportunity to remember him in that way. And so I really encourage innovation as a minister. If you can work with your faith community to find ways that you can do it differently than being in person and having a funeral service, I believe that's also possible. We've seen beautiful memorials done in the hospital through glass pane windows, or at nursing homes where people can't come to the door, but they'll show up and drive or create some kind of parade or procession to honor their loved one. So I would say not to let the pandemic take away your ability to memorialize your loved one.
Jeremy, thank you so much for sharing that. And 2020 was such a year for so many people, and I'm just so sorry to hear about the loss of your dad. I've, dealt with the grief of losing my parents in the past couple of years, and it was really interesting. My mom's funeral was during this horrible snowstorm, like one of the worst snowstorms we've had in North Carolina, and it really shut down what we expected and hoped her funeral to be, and the people who were able to come and mourn with us, right? And that's something that really sticks with you for a long time, like that inability to celebrate end of life with all the people who she meant so much to. So, but we still were able to have, at least 50 people, and, here we are in COVID and people can't even say goodbye. And yeah, it's devastating. It's heartbreaking. So thank you for sharing that with us and giving some ideas on how people can mourn and cope with those losses during this hard time. Let's see, Cheryl, I have a question for you. So for families, for parents who are struggling with their own mental health issues and struggling with the difficulties of, caring for children during this time, without support, without the village, right? Without that social network from family and friends due to COVID, what resources are there? We know as mental health workers and as, pediatricians that child abuse and neglect can increase during times of, stress and isolation and trauma. So what resources are there for parents struggling with this? What do you recommend?
So one of the things that we have at Interact and we're still able to do is our support groups. We have been able to do that virtually, and we typically offer them each quarter, whether it's, wintertime, springtime, that sort of thing. And we do talk about the effects of domestic on children and how it affects their growth, how mom can do some self-care and making sure that she's taking care of her and taking some time out for herself. Also, parenting classes at Safe Child, participating in. One of the things that we do ask them if they could possibly, especially if they have younger children, is to get them onto some type of routine. And if you can get them on that routine and you can get them in a bedtime that is stable, whenever you get them in bed, then that gives you the evening to kind of wind down for yourself, to do something that, if it's no more than to read, if it's to take a bath alone, because we know as parents, just being able to do something as simple as taking a shower without being interrupted is self-care. We also talk about what Dr. Spells and yourself as well talked about, getting them outside, give them a little time to get that energy out of them so that they will be able to sleep better. There's a lot of handouts and guides that we have at the office, and then they're always able to call our crisis lines. Those crisis lines are 24 hours, 7 days a week. And we also have the ability to do chat. So if they're not able to talk on the phone, but they can go to our website and initiate a web chat. So they'll do it through their cell phone and we're able to respond back to them through chat. We found that to be very helpful as well.
Thank you. I love those practical tips. I think a lot of people are struggling during this time. It's hard being a parent outside of this isolation and stress. This next question, Dr. Bronner, I want to pose to you. Wendy Herrera Tenorio asks, I am so concerned that my 21-year-old daughter got the J&J vaccine Wednesday of last week. So my anxiety is so bad. What can I do to think positive? So Dr. Bronner, I want you to talk about some strategies, but I also want to reiterate to Wendy that the rare blood clots that we've seen are literally 1 in 1 million. And so the absolute vast majority of people who have gotten the Johnson & Johnson vaccine have experienced the typical side effects that we expect after a COVID vaccine of, feeling a little crummy for a day or two. But Dr. Bronner, how can she think positive and deal with the anxiety that she has over this? Dr. Bronner, you're muted.
Sorry about that. Yeah, that's a very good question. And I think one of the most important things is to focus on the facts. As you just were saying, most people, it's a very rare event. And so the fact that the likelihood that your daughter would be having any side effects is probably very, very low. And so a lot of times people tell themselves certain things that aren't true, and those things are the things that cause them the anxiety. So continuing to challenge any kind of negative thoughts or irrational thoughts can be a first place to start, to make sure you're actually telling yourself what actually is going on. And other things to do is just basic things that one can do for anxiety. And I usually tell people to focus on the basics. You know, are you sleeping well? Are you eating well? Are you drinking enough fluids? Are you exercising? And are you connecting with people on issues other than the vaccine or COVID or things like that? Connecting with people on things that bring you joy, on things that help you to feel better. You know, these things are going to creep into your mind, but if you can start to maybe direct your attention to other things, then you can start to decrease that stress related to your thoughts about the vaccine.
Thank you, Dr. Bronner. While I have you here, I want to ask you one more question. What can we do to promote social and mental health for seniors who are dealing with social isolation?
Well, that's a very interesting question because some of the things that I talked about when I first did my opening remarks was about social isolation. And a lot of patients that I saw coming onto the inpatient unit were seniors because a lot of times seniors prior to COVID were isolated. And then, of course, became more isolated once COVID started because even some of the people that they were seeing before COVID weren't able to come to see them. And so a lot of things that we talked to them about was trying to be creative about how they were going to interact with other people during this time, because, of course, they're at an increased risk of developing the disease. And so they had to figure out ways to intentionally talk to people over the phone, or we had people driving up and talking to them from their car, and they were in the house, and so they could continue to have connections with people in those ways. If they were tech savvy, they could do a lot of things on their computers in terms of groups and chats and those kinds of things. And so, even though seniors may not have been thinking about those kinds of avenues, they sort of welcomed some of the brainstorming about things that they could do to try to keep those connections until they could actually go back out and interact as they had been before.
Thank you. I love those ideas. And then also, the fact that many of our seniors, maybe 60 to 70% of our seniors have received, a COVID vaccine, seen people who, have felt comfortable then going out or, of course, still small groups and masked and even outdoor, but, seeing grandchildren again, right, for the first time in a year, or hugging their adult child who may have also gotten their vaccine. So, it just gives me so much hope that better times are near.
Yes.
So, so for our participants, I just want to remind you about the poll questions that Lachelle Warnell posted at the beginning of the presentation. Please take some time right now to answer those poll questions. I'm going to give you a brief interlude. All right, so these next two questions I'm actually want to pose to Dr. Spells. And I think they're somewhat related as we're talking about resources for child and adolescent mental health. So the first question is, I'm undocumented and have a child with mental health needs. Is there somewhere safe that I can take them for help without risk to me? That's the first question. The second question is, my teenage child has developed mental health symptoms but does not want to agree to treatment. If they become dangerous to themselves or others, what options do I have? So can you talk about those two things together? So in a child with mental health issues where the parent is undocumented, what resources are there that are safe for the parent to take them to? And then if a teen becomes dangerous to themselves or others, what options does the family have?
So on your question about, or the part of the question that references the parent being undocumented, the services are still available to the child through the community mental health centers. And there's no expectation for us as physicians there or ancillary staff, et cetera, to report or document. And in fact, typically they would be able to be helpful in getting tied with additional resources for the family as well. So that would be the place to start. With regard to teenagers who are not interested or willing to voluntarily participate in mental health treatment, and you as the parent are saying, oh my goodness, my child is unsafe, I'm worried they're going to harm themselves or they are harming themselves. The good news is that in North Carolina, you are allowed to have your child admitted against their will. If it appears that that is a necessary step. There's not really as many resources when it comes to outpatient treatment, forcing outpatient treatment, unless there's been something really terrible happen, a suicide attempt or something like that. Outpatient commitment in children is not as much of a thing. It technically exists, but it doesn't work the same as an adult outpatient commitment. And so if your child is expressing suicidal thoughts, not willing to go see a therapist, there's two ways that you could proceed. Neither of them are highly desirable, but we're talking about an emergency crisis scenario. So you can call the police and have them assist you in getting your child to the hospital. They will take them to the hospital for you if you can't get them into the car. The other scenario, if you have another adult that could supervise, it's kind of still the same. Well, the other scenario is if you can get them in the car, you take them yourself. But the third scenario, I said two, but there's, I guess, three. So the third scenario would be that if you had someone that could supervise them to where you could leave them alone temporarily, then you could go to the magistrate, your local magistrate's office, and initiate the commitment process. It's paperwork that you have to fill out that says kind of why you're worried about your child. And this is the same process that occurs in adults, but it exists for children as well. But you say, my child has been saying they want to die. They have been engaging in whatever behaviors. So they're cutting themselves. I found a stockpile of knives. I found these things that make me concerned that they are going to, in the very near future, try to do something harmful. Or they're, being aggressive toward us. They've attacked me with a utensil or something like that. They then continue the process. So from there, when the child is taken to the hospital, they're evaluated then by, depending on what facility that you're in, there's sometimes a crisis team where you're evaluated by a team of either social workers, nurses, and sometimes you'll be directly evaluated by a physician. Physician is involved in the final decision typically, but provided that they agree that your child is imminently dangerous, then they would be admitted. Sometimes that's a slow process, which can be very frustrating for families because the availability of beds is sometimes inadequate, and therefore there are times when the family will have a long hospital stay in the emergency room while they're waiting to be admitted, transferred to a facility that has inpatient child and adolescent psychiatric services. So that would be the procedure to go through if that were, again, if it was an imminent scenario where you felt like your child was unsafe to stay at your house.
Right. Yeah. Gosh. And of course, no one hopes to ever be in that situation. And you pointed out that if it really were an emergency and you needed to get your child to the hospital and you were unable to do that, you can call the police, which of course we know in our communities, of color, there certainly may be some anxiety about involving the police. I know that you can specifically call and ask for a CIT officer who is trained in mental health, and make that information known when you make the call, that someone is having a mental health, emergency.
And I would definitely want a person to do that. Be sure to explain that that's what. Don't call frantic. They're attacking me. Try to be as calm as you can, but explain that you think that this is a mental health issue, because there tends to be a different approach from the officers, even the ones that aren't directly trained.
Yeah, that's an excellent point. Cheryl, I'm going to come back to you with this question. With so many instances of violence happening throughout our nation, police shootings and mass shootings and, all of these things that we're seeing on the news every day, what recommendations do you have for taking care of someone and taking care of their family and community as they are witnessing and being affected by so much violence around us every day?
That's a really good question. For me, a lot of times when I see the violence that is going on the news, social media, it does have a way of dampening my outlook, especially within our community. And sometimes you can also get that sense of hopelessness. But one thing that I have to say, that as far as African Americans are concerned, we are a very resilient people. And we have overcome so much within our history of being here. To be able to support one another and pull together is always something that I feel like our community can do, and they do it well whenever we begin to rally around each other. Whenever it comes down to, when I also in the domestic violence sphere, is if our clients have a very strong support system, so that's extended family, that is coworkers, it's family and friends, it helps them to do better. It helps them to be able to rebuild their lives. One of the things that abusers will do is to isolate them from any type of support whatsoever. And so again, that feeling of hopelessness comes into play. And there's no one out here who's going to believe me. No one is going to be able to look out for me. And so the same thing happens within our community. Whenever we are constantly seeing something that's happening with police officers and we're being killed and murdered in the streets, that sense of there's no one here to help us, no one here who's caring about us. But we know that that's not the case. If we watch ourselves, if we pull stronger within our communities, if we reach out to one, even within my community where I live now, we do the whole neighborhood watch thing. And I have a lot of seniors that are in my neighborhood, and I walk my community. And if I see them out and about, I will speak. I will make it known that I know them and they know me. And so having that sense of community that is there, I think is always necessary and helpful in times such as these, during the violence that is out there.
Thank you so much for that. One of our listeners, our viewers, Adrian Sylvie, kind of echoed Dr. Spell's the conversation that we were having about the anxiety about calling law enforcement right now. I also know we talked about when you call, let people know that you think this is a mental health emergency. But there's also mobile crisis units in Wake County. I actually helped someone with this recently. And you know, you can actually Google it. There are a couple of different ones through, you know, UNC Wakebrook and Raleigh and Monarch and DHHS, but you can look for that on the internet. But there's 24/7, you know, advice lines and mobile crisis units that can be deployed that people also can take advantage of. So I just wanted to add that for our listener, Adrienne Sylvie. Reverend Gilmore, can you talk about how faith, you know, is healing, how faith, you know, plays into dealing with grief and well-being, especially during this time? How have you seen that be helpful to people?
Yeah, absolutely. The Pew Research Center says that upwards of 80% of African Americans find religion important in their life. And just, I mean, I think colloquially and anecdotally, we know that for lots of folks, their faith community is very important to them. And so what I recommend really is for the if it's a church or if it's a synagogue or a mosque or whatever faith community you're part of, or it's a faith community of your own creation, that you find ways to hopefully to support mental health within that community. What studies have shown also is that the faith community can have a very strong impact in destigmatizing mental health and recommending people to go talk to counselors, and the leader of the faith community being able to say that they too might struggle with mental health issues and see someone or might need medication from time to time, but normalizing outreach and normalizing receiving support. We've seen that time and time again. There again, more studies that talk about the benefits of prayer and decreasing anxiety, and meditation and decreasing anxiety, on how listening to gospel music is helpful. And it's like, well, that's just what grandma used to do. Well, grandma was she was self-medicating, you know, and she wouldn't call it that. But there was if you play music at 66 beats per minute, it apparently decreases your anxiety. And so even though, you know, we can't name all these things, our faith has been a source of strength and support in hard times and in grief and loss.
Thank you so much. I love that you mentioned music. I think we all have been in an experience where, you know, we found, you know, healing or expression of an emotion through music. And, you know, whether it's, you know, gospel or just music at 66 beats per minute. I love that. I love that idea, because I think a lot of people can relate to that. At this time, I am going to turn it over to Lachelle Wardell for a review of the poll questions. Lachelle, are you able to pull the poll results up for us?
Thank you, Dr. Monroe and all of our guests. So let me look at our poll results here, and just give me a second. And I will, okay. I am going to share my screen again, and hopefully I can stop sharing after we're finished, so we can take a look at our poll results. Okay. And so as of this point tonight, we've had 19 people to complete the poll. And so we'll take a look at the responses that we have so far. And so we'll see the zip codes in which people live that have responded to the poll. At this point, 56% of our participants are identify as Black or African American, 33% white, 11% other, 6% unknown. And then with that, 74% are not Hispanic or Latino, and 26% are. Then we asked, what population do you represent, and asked folks to check all that apply. So 47% of our participants tonight represented the general public, 18% represent community organizers, 18% faith leaders, 12% healthcare providers, and 6% public health practitioners, and then another 6% other. When we looked at age range of our participants tonight, we had a majority, 50% of our participants in the 46 to 65 age range. The next highest group was 25 to 45 years old, and older than 6% was our 6%. And then we didn't have any young people younger than 25 on tonight. So we also asked if folks plan to get vaccinated. And so 83% said that they were already vaccinated. 11% said no, they weren't planning to, and another 6% said that they were on the wait list. So then we asked, if you weren't planning to get vaccinated, what were the reasons why? And so let's take a look at those results. Of course, 73% have already been vaccinated, but 18% of that, which is 2 people, said that they were concerned about the side effects of the vaccine. Another person said that they thought you can get COVID from the vaccine. Someone else said other. Those were our responses. And then we asked who people trusted to get them reliable health information about the COVID pandemic and vaccine. And so 72% trusted you all. They trusted their healthcare workers. 61% trusted Dr. Anthony Fauci at CDC. 61% trusted CDC. 44% said they trusted the county government officials, whereas 33% said they trusted the state government. Another same 33% said they also trust Governor Roy Cooper. 33% President Joe Biden. 22% said that they trusted their faith leader for information. But the 17% said community health workers, and 11% family or friends, and 6% said radio or TV news reporters. And then finally, we wanted to get a sense of how useful people found this session. And so the majority said that it was either very useful or somewhat useful. And then one person said it was absolutely useless. So I'm sorry to that one person. And I hope you reach out to us and let us know how we can improve and make these sessions more useful for you. But those were our results tonight. Any surprises from the panelists? Or any thoughts about the results? And I'm going to stop sharing my screen now.
Lachelle, for me, maybe not surprises, but I appreciate how many people do say they trust their healthcare provider, with information about the COVID-19 vaccine. And I do just want to respond really quickly to, people who are concerned that they can get COVID disease from the vaccine. It is absolutely impossible to get COVID disease from the COVID vaccine. There is a tiny fragment of a tiny piece of the COVID virus that is a part of the vaccine that teaches your body how to protect itself from COVID. So sometimes, you'll hear things on the internet or from other people, and it helps just to kind of get the true story. So we are close to time, and thank you, Lachelle, for that poll. That was really interesting. I do want to give our panelists an opportunity for a closing remark. As we are, still in the midst of this pandemic, vaccinating as fast as we can and trying to protect people to get out of, this mess of 2020 that seems to, last forever. What closing remarks do you have for people, as they're trying to navigate this difficult time? And Dr. Spells, I'll start with you.
We're in a difficult time, And I think that something that's really important is for you to do the best that you're able to do it at any given time. And I think that's the most that we can ask of anybody, is to do the best that you can do. As more information is presented and available to us, we can adjust and adapt, because then the best we can do can be better because we know more and how to combat COVID and to adjust to what's required in order to combat COVID. As this time last year, vaccine wasn't an option. So we're making strides, we're making progress. Make sure that you are engaging in self-care. It's really important. And it's really easy to push that aside because so many other things seem so more pressing. But taking care of yourself and taking care of your emotional stability is something that you need to try to guard to the best of your ability.
I love that. Do the best that you can do. I mean, that's what it's all about. Don't look at other people. Don't have different expectations. Just do the best that you can. That's what we're all doing, isn't it? Thank you so much, Dr. Bronner. What closing remarks do you have for our listeners?
For me, I think discussions like this, particularly in open forums, are very important. They sort of go a long way towards educating the public and addressing the stigma that can be associated with mental illness and keep people from actually seeking treatment. So as devastating as the pandemic has been, it has shed a new light on mental illness, with more people experiencing mental illness themselves and knowing more people that have had mental illness. And so more people are talking about it. And so I'm hoping that that's a catalyst towards people improving their level of support and compassion towards those people that have mental health challenges. So many people are dealing with that. And so I think they're just looking for support.
I love that. If nothing else comes out of this from a mental health standpoint, decreasing the stigma and realizing, everyone struggles and it's not just okay, it's good to reach out for help. So thank you for that. Reverend Gilmore, what closing remarks do you have for our participants?
Yeah, I would say two things. One is to validate your feelings. And as our work in chaplaincy, we encourage people often that what you are feeling is okay. Anger and fear and sadness and exhaustion, and you don't have to be better than you are. I feel like I'm echoing Dr. Spells too to say that, but start from where you are and validate what you feel would be the first thing. And the second thing would be to find resiliency as well, and name your own resiliency. Sometimes you have to name it for yourself, that I'm making it every day, to access the strengths you have, appreciate the people you love in your life, and to celebrate small successes. I can go a little further this year than I could last year, or I can have 4 friends over this year when I couldn't have anybody over last year. Celebrate those small victories too.
I love that. Thank you so much. And lastly, Cheryl, what advice do you have for us and our listeners to kind of close out this session?
Wow, this has been awesome. And with everything that everyone says, I can just pretty much say ditto. I don't know how much more I can add to that, but I will say that, as I tell people all the time, that mental health and mental illness is just as real as a physical illness. And the same regards that you take for your physical body is the same, if not more, regard you should take for your mental health and getting the help that you need. There's no shame in it. If you need prescriptions, medication, or a therapist, a lot of people would like to be able to have someone to go talk to that is going to sit there and listen and be unbiased. And that's what your therapist is going to do. Pull out of those things that are already on the inside of you to get you equipped to go on and continue to face the world.
Thank you all so much. Thank you to Wake County for offering this forum and giving people the opportunity to ask their questions and to get support. Thank you to our experts for your outstanding advice and practical tips on how people can continue to weather the storm. I feel as hopeful as I ever have that we are making the right strides. People are getting vaccinated. We are, protecting our community and protecting our vulnerable people and seniors and children. I look forward to the days when, we can all be together and share hugs. But until then, we will stay safe. We will stay distanced. We will keep masking and washing hands, and we will get vaccinated. We will get vaccinated for our communities and for the people we love. So thank you all so much. Everyone, take care of yourselves. Think of something that you can do for yourself to promote your own wellness. Think of something that you can do today. And we will catch you at the next town hall in a couple of months.